Hi, I'm Dr. Margaret Szott, and I am a family and general dentist in Greensboro, North Carolina. One of the things I am most commonly asked about by patients is how can I whiten my teeth? With social media, selfies, FaceTime, Zoom meetings, and video blogs, our smiles are always out there, and we want them to look bright and white. There is no single answer to this question because it varies as to the reason your teeth may not be as bright as they used to be. Teeth naturally get darker as we get older. To understand this, you need to understand a little bit about tooth anatomy. The tooth has an outer shell called enamel, which is the whitest part of the tooth. The underlying tooth is called dentin, and dentin is yellow in everyone. As we go through life, food and drink and normal wear and tear cause the enamel to wear thin, and therefore the darker dentin shows through, making our teeth appear more yellow. Some people have gum recession, which is where the gums pull back and expose the root of the tooth. The root is covered by cementum, not enamel, and it is very dark in color. The most common type of staining I see is extrinsic or external stain. This stain comes from things that we eat and drink, such as coffee, tea, wine, pomegranates, etc. Some toothpastes and mouth rinses that are used to treat gum disease can cause extrinsic stain as well. This type of stain can be addressed by whitening toothpaste, rinses, and of course, by dental cleaning. I personally use a baking soda toothpaste called Arm & Hammer Bright and Strong to remove my coffee and tea stains and to neutralize anything acidic I may eat and drink. Some stain is intrinsic or internal. This type of stain can be due to high fevers, excessive fluoride intake, or antibiotic use while permanent teeth are developing. This type of staining can't be brushed away or bleached away very well. This type of staining must be covered by fillings, veneers, or crowns. Another type of intrinsic stain is due to the normal wear and tear and thinning of the enamel that I mentioned earlier. This type of stain responds well to bleaching. Bleach trays can be made by the dental team that are worn between 30 minutes and 2 hours per day for 1 to 2 weeks. It is impossible to know how your teeth will respond to bleaching. Some people get very sensitive to the 20% hydrogen peroxide gel that we prescribe in our office. This sensitivity will resolve in a few days and does no permanent damage to teeth or gums. White strips, which are an over-the-counter product, work much the same way as bleach trays but have a less potent percentage of hydrogen peroxide. I often recommend white strips to my patients that are susceptible to sensitivity. I try to bleach my own teeth with Crest 3D white strips once per year. Remember, if you have crowns and fillings on your front teeth, they will not bleach. So if you do bleach your front teeth, you may have to have those crowns and fillings replaced to achieve a uniform smile. Regardless of the whitening treatment you choose, you are very likely to get some positive results, giving you a whiter and brighter smile. The Academy of General Dentistry recommends dentist supervision for any whitening treatment, including over-the-counter options like the white strips. If you are in need of a professional cleaning and ready to explore whitening solutions, we invite you to call our office at 336-286-9897 to schedule an appointment. Again, I'm Dr. Margaret Szott, and remember, a smile lasts a lifetime.